Hi, my name is Tony Millian. I'm the managing partner of Practice Copilot. I'm here to talk to you a little bit about a concept that's very specific to how we do our consultancy work, and is something that I think can help your practice significantly. It's a concept called lean. Okay, I'm going to talk to you about this concept, and it came out of the Toyota production system back in the 1950s. A gentleman by the name of Taiichi Ono really looked at how he could take the current Toyota production of automobiles and really make it a lot more productive and efficient. And so he started looking at different concepts and ways that he could really make things go more smoothly, and came up with a concept that was called just in time, and that ultimately was transformed into this concept called lean as we know it today. So I'm going to tell you a little bit more about what lean is all about through this video, and we'll go through a couple of slides here. Okay. So really the whole entire premise of lean is centered around this concept of value. Okay. In essence, it's really just defined as anything that a customer is willing to pay for is defined as value. The customer is not willing to pay for it, it's really not value. It's actually the opposite of that. It's called waste. Okay. So what we're looking for is anything that's not value in the production system or the processes of your medical office, and we're trying to figure out a way that we can eliminate those wastes, or at least reduce them, so that we can focus on adding more value throughout the process. And in the process of eliminating some of that waste, we make the process a lot more efficient. So I'll talk to you guys about some specific wastes that take place that are defined by this Toyota production system and lean. Okay. So again, if it's not value, it's waste, right? It's really the opposite of value. So if the customer's not willing to pay for it, it's waste. Now you have to think about it though. There's a lot of things that take place in your business that are required for you, whether it be by law, or really along the lines of things that you have to do just to run a successful company, that your customer's really not going to be willing to pay for. They don't care about those things. I'll give you examples of sometimes the accounting processes that you have to go through, or maybe visiting with sales reps by your opticians to make sure that they make the right frame selections and keep inventory up in your office and things like that. Those are things that maybe your customer specifically isn't willing to pay for, but are obviously very important to your office. Now, what we try to do in those specific situations is, rather than try to eliminate those things altogether, we're trying to look for ways to reduce their impact in the office. So again, we can focus on this concept of value, or what the customer is willing to pay for. Okay, so let's talk about 7 specific ways that take place according to lean in really any process, whether that be manufacturing or hospital environments or a medical practice. And in this case, we're going to use examples specific to optometry and ophthalmology, and then in future videos we'll talk about different examples in other types of specialties as well. Okay, so the first concept, and probably the most blatant one that you see in your office, or many people see in their offices, is a concept of waiting. That's probably the most well-known waste of all. Okay, so let's talk about waiting here and how it materializes. Okay, this could be any form of waiting. So this is patients waiting in the waiting room or in the exam room to see a doctor. Maybe a doctor standing out in the hallway waiting for a patient to come into the exam room so they can go ahead and get started with their exam. This could be waiting in the form of products. For example, frames sitting in the optical, not getting processed or pushed through and sent to the lab and sitting there for days. That's another form of waiting. So any type of waiting is a form of waste, and really is something that you should seek to eliminate. And so look for this inside your practice. Okay. A second form of waste that's extremely common, okay, is the waste of motion. And this is really 2 types right here. Motion of either people inside the practice, or the motion of objects or things inside the practice. So Motion of people, for example, is patients moving from one room to another. For example, let's use contact lenses. Patients come in, they go to the exam room first where the doctor wants to see the contact lenses on eye, and then when they remove the contact lenses, they take them back out the pre-test, and the patient goes through and gets an autorefractor and an NCT and those type of things, and then comes back into the exam room. Well, all that extra motion, okay, is extra time that's being spent by that patient moving back and forth, and in essence is weight. It's waste. It's something that the patient really isn't willing to pay for, and it causes extra time for the practice. The second type is the motion of things, which could ultimately cause motion of staff as well. So I'll use an example here of a specific office I visited here recently that would share an eye care tonometer. And they would put the eye care tonometer in little baskets in front of the exam rooms outside. And so the techs would come around outside during their workup, and they'd try to find where this eye care tonometer was so that they could take it back into the exam room with them and complete their workup. Now, what would happen in a lot of cases was they would walk out. The eye care tonometer was nowhere to be found because it was in use by some other staff member for another patient, and they'd have to sit there and wait for it. So obviously this waste of motion, having to move around looking for things, also creates a waste of waiting in this particular case because the staff member had to wait for that particular piece of technology so they can go back into the exam room and complete the workup. So this is definitely another one of those wastes to look out for in your practice. Okay, this is another very specific waste. It's called the waste of processing. Okay, so specific example here that I saw here recently in an optometry office was an office that felt like they were making a significant number of errors in terms of placing their orders once the patient came in and bought the frame and the lenses. So what they would do is they would hold that order and they would stack it up in the back office, and that order would get inspected basically by an optical manager. Well, what happened was that optical manager would get busy, and they would have a hard time getting back to that job, and sometimes a day or two would go by before they would inspect that order and go ahead and process it themselves. So that was actually increasing the turnaround time for those frames for those specific patients. So again, over processing is one of those specific wastes as well. Okay. The next waste is another P waste. It's a waste of overproduction. Okay, and this is different than over processing in that it's really working faster or doing more than you need to do in that given moment in time. So a great example of this is in many cases, in many offices that I visit, the techs have a tendency to outpace the doctors in the exam room. And what they want to do is they want to make sure that they keep the exam rooms full. So as soon as a patient comes in, they'll try to work up that patient if an exam room is available. And they'll fill the exam room up with patients, and then what ends up happening is rather than waiting in the waiting room, the patients end up waiting in the exam room for the doctor, which is just as bad because the patient walks into the exam room, they feel like the process has started, and then all of a sudden they're sitting there waiting. Sometimes they wonder if somebody's actually forgotten about them during that process. So again, this is a process of trying to do more than you need to because if they hadn't brought that patient back, the patient would have been waiting in the waiting room. But the real essence of the problem here isn't so much an issue of trying to get the patient back quickly, but more how do you rebalance that process so that the techs don't outpace the doctors and so that the doctors can't outpace the techs either. And that way the process is balanced and everybody's going smoothly throughout the process. So process of or waste of overproduction. Okay. So another one you guys are probably very familiar with in optometry is the waste of inventory. Okay, so in this specific example, one that's very very common is really carrying a significant number more frames than is necessary in the optical. In order to keep a really nice full optical, in the office, a lot of offices have a tendency to carry a significant number of frames and frame lines. And a lot of times these frames don't move very well. They don't get a lot of turns out of them. And what ends up happening is you tie up a lot of cash in inventory just because you're trying to keep a nice optical. So certainly something that needs to be balanced there, and one that's very common. Obviously on the flip side, contact lenses and maintaining a lot of revenue lenses that are held there just in case patients come in to make their purchases can also create excessive inventory and holding of cash there that could be used or repurposed for other things. So another waste to look at. Okay. So coming near the end here, this is our sixth waste. Okay, this is the waste of obviously making mistakes. So a specific example here I saw recently in an office I visited was an issue with authorizing insurances incorrectly. So this particular office was not gathering sufficient information during the scheduling process, and when they went to authorize the insurance, they would either have the wrong insurance group number and things like that would cause issues with the authorization, and a significant amount of rework, because then the front desk staff would have to call the patient to try to gather the right information. So mistakes here obviously created a lot of extra work. Another example of this is pretty common in a lot of practices I see, is not collecting the copay or what the patient owes at the end of the visit, or the Optimap, for example, and then having to try to go ahead and collect that on the back end of the after the patient leaves by sending them a bill or something like that. So obviously creates a lot of extra work there as well. So number 6, waste of mistakes. Okay, and then the final one that I think is just about as important as all the rest of them is really the waste of talent. Okay, so you have a lot of really talented people in your practice, a lot of staff members, a lot of folks that really know the day-to-day operation. So tapping into these people to make improvements, because at the end of the day, they know that process better than anybody else, is really critical to be able to do that. Okay. And then certainly I think on another example is really not delegating enough to your techs or your opticians or your front desk, because you may not necessarily trust the quality of the work that they're doing. That talent is there. Take advantage of it. So that's waste number 7. Okay. So I'd like to say thank you for watching this video. And I hope that it was helpful to you. It gave you an introduction into what these lean concepts are all about, and these 7 wastes that are very typical in lean. And what I want you to do is go back to your practice and think about where some of these wastes are occurring and whether there's ways to improve it. Because at the end of the day, it's really all about looking incessantly for ways to try to improve some of these processes, and looking for where these wastes exist and seeing if you can make that process better. Okay. If you guys have any questions, please feel free to contact us at any time. Our email address is info@practicecopilot.com. If you email us there, we'll be happy to answer any of your questions, or talk to you a little bit more about your practice and see if we can help you out in any way. Okay. And then finally, last but not least, please feel free to go on Facebook, facebook.com/practicecopilot, and like our page. We're going to have lots of great content on there. We're going to keep adding posts about practice management topics and different experiences that we have as we go out and do some of this consulting work in optometry practices and other healthcare practices. So there's a lot to learn on that Facebook page. And finally, the LinkedIn page. So too long of a URL to put here, but just go on LinkedIn and look up Practice Copilot. Feel free to follow us there. Another great source of information as you're looking for practice management topics. Thank you, and have a nice day.